Hello, good afternoon, ladies and gentlemen, and welcome to this live Facebook chat. We're currently here at the Liverpool 5th Global Health Symposium on Health Systems Research, and I'm here today. I'm delighted to have a friendly chat with my friend, Kingsley and Chikapupa. He's from Malawi, and our topic for today is going to address the role of communities in health systems and how could we engage communities in our health system, especially in fragile contexts and low and middle income countries. So welcome Kingsley to this interview.
Thank you.
So I would start first with introducing myself. My name is Sameh, I'm from Yemen. I'm one of the emerging voices for global health, 2008 and 18 cohort. I've been working in the field of humanitarian aid and health programming for the last 8 years, and I came to Sheffield last year to pursue my master's, and the theme of my master will be focused on governance of health systems in transition at the University of Sheffield and also at the Jagiellonian University in Krakow, Poland. So Kingsley, would you please introduce yourself and tell us what are you doing in the field?
Thanks so much, Sama. My name is Kingsley Chikapupa. I'm from Malawi. In Malawi, I'm working with a research institute that is called Reach Trust. So that is Research for Equity and Community Health Trust. So we are mainly involved in health research, and I have conducted research mainly on community health workers across the globe. I've also been involved in fragile states, to be specific, in South Sudan. So I'm currently also in the UK. I'm doing my master's at Liverpool School of Tropical Medicine in international public health.
Interesting.
Yeah.
So Kingsley, from your perspective, when we talk about health systems and communities in health system, what do we mean by that? Because according to my observation, we've noticed that the term is quite fluid, and it changed based on the different context. So I'd like to to put perspective. What is communities and what is communities in health systems?
Yeah, I think maybe firstly when we talk of community health systems, probably we should start from there. What do we mean?
Yeah.
So I think we all know that when we talk of health systems, we are talking of actors, players, institutions that are involved, in ensuring that there is a restoration of health in the population. So, community health system, we are mainly looking at these institutions and players and actors that are mainly involved at providing health services at the community level. So we are looking at healthcare reaching out to people at household level, at village level, at facility level. And we tend to look at all these players and actors in terms of what is it that they are actually doing, what is their role, what are their responsibilities, to just make sure that we are able to at least achieve health of the population, but mainly looking at the community level.
Okay, so I understand from your comments that everyone who is involved in the communities, they are part of or involved in provision of health care in a direct or indirect way. They are part of the community health system.
Yes.
So my point here, how could we link that community component with the health system? Do you think there is a sort of division between community and health systems in our context? What do you think about that?
I wouldn't say there is a division, but probably the issue is how do each player or each structure within the health system's hierarchy contributes towards the other, so that there is that coordinated or systematic way of doing things. So, for example, when we talk of community health systems, we are looking at what is the role of the communities themselves, because they have a role and they have a responsibility also to ensure that they attain health. Yeah. So, be it mental health, socially, physically, what is it that they are doing, and what is it that maybe the broader health system is also actually doing to ensure that communities are actually able to attain that health. And what is the role of other players, the NGOs, government institutions? What is it that they are doing How is healthcare being provided from their perspective to ensure that the population attains health?
Yeah, I heard that.
Yeah.
So just a reminder that everyone who is seeing us now, we can you can post us a comment and we'll respond to your questions. So feel free to drop us a line anytime. So when I was in Yemen in 2015, I remember I used to manage a program for health and nutrition for an NGO. And one of the activities that we used to do is to recruit community health volunteers. Actually, community health volunteers were, the program was part of the Ministry of Health policy. So we used to implement that program. It was fantastic. Most of the volunteers, they were very enthusiastic. They went to their communities to deliver maternal and child health care messages, and they are also referring children to the nearest health facilities who were suffering from acute malnutrition. The program was fantastic at the beginning, but after a while, I've noticed that most of the volunteers, they were complaining about, they can't cope with the demand of their jobs. They need sort of incentives or a sort of support to their transport, and unfortunately, the government policy, didn't support that. So that was one of the challenges about how can we involve volunteers in the formal health system as an important community component, and at the same time, while we don't have enough resources to support that component. So that was one of the things that I was spinning my head around. So, from your experience in lots of lower middle income countries, what are your solutions that or the way forward to integrate community health workers within the formal health system?
Yeah, I think you're bringing a very important, issue here when we talk of health systems. I forgot maybe to mention when I was introducing myself, I am currently the co-chair of the Community Health Workers Technical Working Group of the Health Systems Global.
Yeah.
And so we are mainly looking at the role also of community health workers. And I think my experience shows that maybe we should be going back to look at the way the issue of community health workers was introduced and how that was embraced. Because I think we find out that in a number of countries, in low and middle income countries, community health workers are actually volunteers.
Yeah.
And more of them tend to be women.
Yeah.
We have specific cases, I think, in Ethiopia, Malawi, Kenya, where I think the government actually came in and introduced criteria to kind of recruit a recognized government-paid cadre of community health workers. But even with that structure, there are still some problems, I think, that are also coming with the community health workers.
Yeah.
I think the problem is more of a governance issue other than the community health workers themselves. So you talk of volunteers, I think that is also a debatable issue. It is a hot debate actually here, even in HSR 2018. Do we want to continue with voluntarism, okay? Or do we need to think of incentivizing our volunteers? Even the community health workers that are now recognized by governments, are they getting the necessary support, the requirements, the resources, the skills that can actually enable them deliver the services that are expected of them? So I think that is the main issue that we need to be looking at way forward.
Yeah. Thanks for that, Kingsley. And I'm seeing a question on Facebook live chat. The question says, is the community health systems bigger than health systems alone? Or is that the correct question? Is the community health system bigger than community health workers alone? That's the question.
Community health systems is not bigger than health systems. Community health workers are not bigger than community health systems. I think the word here is systems. Okay, so what we are doing with community health systems, I think we are just looking at a component within the broader, the formal health systems. So I talked at the beginning to say we are looking at a structured, a systematic and organized way of doing things. So could we maybe say, let us be looking at the community level in terms of how organized are our systems at that level. And then we go up the ladder to the broader health systems, which in many cases actually I think is also like the responsibility of government, the Ministry of Health as the custodian, who running the stewardship role of the overall, provision of healthcare, I think, in our settings. So I think we shouldn't be having questions like which is bigger than what. Because it's a system.
Yeah, and I do agree with that, and I will reiterate that community health workers, they are part of the health system. So we should look, at the workers, within the Ministry of Health and the formal health system umbrella. So which one has an important role in provision of services. Sure. And picking up on that, how do you think what's the role of community or the community health workers in the progress toward the achieving universal health coverage? And when I say universal health coverage, it means that anyone in any community has the right to access quality health services at an affordable price without exposing himself or herself to a financial hardship. So, what's the role of community health workers and community health systems with the universal health coverage?
I think talking of coverage, that is actually a key issue. So that becomes a role for both community health systems as well as the broader health systems. One key issue that comes to mind, I think, is the issue of accessibility. Okay, so how distant are the healthcare facilities to the population in terms of access to the healthcare services? How affordable are they? You talked about affordability. As we speak now, in a lot of low middle income countries, healthcare is expensive. Out-of-pocket expenditure for the population is really huge because of issues of distance that these people are actually traveling to access healthcare. If they resort not to go to the formal health facility, then they resort to go to either groceries, either traditional healers, which is not even cheap at all. So there are a myriad of factors and issues that actually come into play when we talk of achieving universal health coverage. And for me, the affordability, accessibility, and even availability of services is key. And that's where probably the role of the community health workers, I think, comes handy, because they work with the communities. And like you said earlier on, these are volunteers that are actually selected from within their own communities. So they understand the environment better, they understand the people that they're dealing with better. But the issue is what I talked about. Are they getting the required support? Okay, are they getting the required skills for them to actually be able to make sure that these people are able to access affordable healthcare?
Okay.
Yeah.
So just to summarize what you've mentioned, is that governments should invest in community health workers to achieve universal health coverage. They are a very important part, and they are very vital, and they should be fully integrated to achieve health coverage.
Exactly. Community health workers are very vital. And we have countries actually who have actually said some of them achieved the Millennium Development Goals. Go 4, Go 5. They attribute that to the role of community health workers. But we need to go to do more in terms of investment. Supportive supervision is key. The community health workers, we can't treat them as a magic wand. No.
Perhaps maybe in the next symposium in 2020, we could have special discussions and special thematic discussions on the role of communities, and the role on how to translate the role of communities and to engage them at field level to be part of the formal health system. We need implementation. We've talked a lot about the role of communities for ages. I think now it's the time to have to move to the implementation phase.
Exactly.
I think we've got a question on Facebook. Our brilliant Vivian is capturing the question. So just hold on for a few seconds. So
but
just on the out-of-pocket payments, by the way, in Yemen, it was in 2015. I remember it was 78% of the population in Yemen. Just at the beginning of the crisis, they were paying out of their pocket. So it was catastrophic. And now I imagine that it is much more higher. So let us take the question.
Okay. I just wanted to comment,
Yep. Please.
to say within the Community Health Workers Technical Working Group of the Health Systems Global,
Yeah.
we will be having a Community Health Workers Symposium in 2019 that will be held in Bangladesh. And we are also creating this platform to have that specific moment, particular moment to actually critique the issue related to community health workers. And we would like also to use this platform to actually hear more from the community health workers themselves. So we are encouraging participants to HSR 2018 as they go back to their countries to make sure that community health workers are part of this symposium, because oftentimes we hear from researchers, policymakers, but we need to hear also from themselves.
There is a question from the Facebook chat. They're talking about which tech tools or technological tools are effective to support an effective support to the community health workers in low and middle income countries, especially for non-communicable diseases. From your experience in different African contexts, what are these technological tools to support CHWs?
Yeah, a lot of organizations are coming with a lot of technologies, which is good because we are living in a modern era which is actually booming with technology. But you heard me talk more on the skill set of the community health workers. We need to do more first in ensuring that they are well capacitated in order for them to work with the emerging technologies. Otherwise, if we just come in with technologies and do them, we have seen them actually even struggling with things like data collection tools, matrices, which have a lot for them, and sometimes they don't even understand what we're asking them to do, except that we are able to tell them we are only interested in 1, 2, 3, 4, 5 indicators. But if you ask them for the whole matrix, the whole tool, they wouldn't actually make sense of it. So we need actually to invest more in the training, capacitating community health workers so that they are able to actually deliver the services. I'm happy with the countries that I mentioned, Ethiopia, Kenya, Malawi, and Uganda, and others, who have like a recognized cadre of community health workers. They are trying to do that, but I think there is still a lot that needs to be done.
Investment needed in the class. We're running out of time, so I'm sorry we have to finish this conversation. But of course, we're having more discussions in the symposium. And we just summarize the main theme of these discussions by saying that the communities and the community role is vital in health systems and in achieving the universal health coverage for everyone. There should be integrated, there should be respected, there should be empowered, so we can achieve the best health outcomes for everyone. Thank you so much for your time, and thank you so much, Kingsley, for your time.
Thank you so much.
It was a pleasure meeting you again.
Pleasure.
So we'll see you soon in another live Facebook live sessions. Thank you.